I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truth about men's health, especially sexual health. One of the most common questions I get from men is, can I get longer? Can I get bigger? Is there any way to increase my girth? If you're in your 60s, you're not alone. Many men feel dissatisfied, even though most of them are well within the medically normal range. In today's video, I'll share with you the scientific truth. Heavy checkmark what the average penis size really is, according to medical data. Heavy checkmark which methods are actually effective and safe. Heavy checkmark and when you should be cautious about misleading advertisements. Size isn't everything, but understanding your body and what's truly normal can help you live with more confidence and control. Let's start with the fact that might surprise you. In a survey of over 50,000 heterosexual men, 55% said they were dissatisfied with the size or shape of their penis. But when their female partners were asked, 85% said they were completely satisfied. This reveals a clear gap between how men perceive themselves and how others actually see them. And at your age, this gap can quietly affect your confidence, relationship quality, and self-esteem. One of the main causes? Pornography. What you see on screen is not biology, it's selection, staging, and exaggeration. A study published in the Journal of Urology found that the more men watch pornography, the more likely they are to underestimate their own size, even when they fall within the normal range. When you constantly compare yourself to a fictional standard, it's easy to fall into anxiety, insecurity, and eventually lose confidence, even when there's nothing physically wrong. Here's the truth. You don't need to change your body. You need to change how you see it. And that's the first step to reclaiming the confidence, connection, and masculine strength you truly deserve. So, what's the truth? According to a comprehensive review of multiple international studies, the average length of an erect penis is 13.2 centimeters, or about 5.2 inches. Medically speaking, any size within plus or minus 2.5 standard deviations of that average is considered completely normal. Only when the erect or stretched length is below 7.5 centimeters, 2.9 inches, is it classified as micropenis, a condition that occurs in just 0.14% of men, usually due to congenital, hormonal, or surgical causes. But here's what matters even more. Most men who feel insecure about their size are, in fact, completely normal. This is not a size problem, it's a body image issue. In medical terms, it's called penile dysmorphic disorder, a form of body dysmorphic disorder specific to the genitals. And for some men, this obsession becomes so intense that it affects their mental health, their sexual well-being, and their relationships. You don't need to change your body. You need to change the way you see it. Because science is clear. Most men who worry about being too small are simply unaware that they're already within the normal range. That doesn't mean your penis is small. It means you're experiencing excessive anxiety about your size, even though you're completely within the normal range. This condition is known as penile dysmorphic disorder. Many men spend over an hour a day looking in the mirror, measuring, comparing, and falling into shame, self-doubt, and isolation. For some, the obsession becomes so intense that it starts to affect their work, marriage, and even leads to depression or suicidal thoughts. And the worst part? The internet is flooded with misleading advice, unproven techniques, and dangerous marketing promises. Many men end up paying for penis enlargement procedures from unlicensed clinics or traveling abroad for quick fixes, only to suffer complications, permanent damage, and lifelong regret. Please don't go down that path. If you're feeling insecure, the first thing you need is not a device, but accurate information and qualified medical support. If you're feeling anxious, the first step is not to buy a device or try a trick you found online. Start by speaking with a qualified urologist or licensed mental health professional, someone who truly understands this issue and can guide you safely. Before I share the possible treatment options, here's something important you need to know. The North American Society for Sexual Medicine recommends against performing penile enlargement procedures unless there is a medically diagnosed case of micropenis. In other words, most enlargement procedures currently available are not widely recommended because they are still considered experimental. What I'm about to share are methods that do appear in reputable urological literature, but they come with varying levels of clinical evidence. And if you're considering any of them, always do so under the supervision of a qualified medical professional. We can divide the available approaches to penis enlargement into two categories: non-surgical and surgical methods. The first, and perhaps most important, option is psychological counseling. Many men feel anxious about their penis size, even though they fall well within the medically normal range. This condition is referred to in medicine as penile dysmorphic disorder, a form of body dysmorphic disorder, BDD, specifically related to the genitals. According to a study by Veal et al., published in the International Journal of Impotence Research, the majority of men who seek treatment for size concerns actually have average or above average dimensions, and most of them exhibit signs of body image distortion. Once properly counseled, many of these men no longer feel the need for devices or other interventions. If you still wish to pursue physical solutions, you'll commonly hear about three options: penile traction devices, vacuum erection devices, and penile filler injections. Among these, traction devices are the only method with consistent evidence of increasing length, though modestly. A study by Martina Salamanca, published in European Urology, found that using a penile traction device for 4 to 6 hours daily over several months led to an average increase of about 2 centimeters in flaccid or stretched penile length. However, this requires significant commitment, and side effects may include numbness, bruising, or no improvement at all. Vacuum erection devices, VEDs, are FDA approved for treating erectile dysfunction, not for increasing penis size. The American Urological Association, AUA, states that there is no reliable evidence that long-term use of VEDs leads to permanent length gains. The third option, penile filler injections, is by far the most dangerous. Although substances like hyaluronic acid, liquid silicone, and other synthetic fillers have been tested, they have shown unstable results and serious risks. Research published in the Journal of Sexual Medicine and Urology Annals documents complications including disfigurement, fibrosis, loss of erectile function, and delayed onset issues that may emerge years later. The FDA has also issued formal warnings stating that no injectable filler is approved for use in the penis. Moving on to surgical procedures, the most common is the release of the suspensory ligament, which can make the penis appear longer when flaccid. However, this does not increase erect length and carries risks such as loss of angle during erection, scar tissue, and reduced stability during intercourse. Other more invasive surgeries, such as skin grafts, synthetic implants, or rib cartilage augmentation, remain in the experimental stage. They are associated with uncertain outcomes, high complication rates, and a lack of long-term clinical data. In summary, no surgical penile enlargement procedure is currently recommended by major medical organizations unless performed within a regulated clinical trial approved by an ethics review board. What's most important to understand is this: most men do not need to change their size. They need to change the way they see themselves. The anxiety, shame, and unrealistic expectations often come from false comparisons, not actual deficiencies. The best path to lasting confidence is not surgery or devices, but accurate understanding, evidence-based counseling, and self-acceptance grounded in reality. Your sexual health is not defined by a number on a measuring tape. It's about function, confidence, satisfaction, and above all, understanding, accepting, and caring for your body in the right way. And that doesn't come from cheap promises or miracle fixes on the internet. It starts with accurate information, reliable support, and decisions based on knowledge, not fear. Thank you for staying with me until the end of this video. If this helped you see yourself in a more realistic and positive light, please hit like, leave a comment, and share this video so other men can also discover the truth. In the next episode, I'll be covering a growing concern in urology, penile filler injections for size enhancement. We'll take a closer look at where this trend started, the risks involved, long-term complications, and real-life stories that many men wish they had known before it was too late. Make sure to subscribe to the channel so you don't miss it. And as always, take care of yourself because you absolutely deserve it.